Today's mindful moment.
It's kind of wild to think that something so small, something you can't even see, just writing on a kid's breath, can actually change the course of history, families, whole countries even. It's that kind of power we're talking about with measles. And it's way more than just, an annoying rash.
Yeah, it's a really amazing example of how something seemingly so simple can actually give us this deep insight into how our bodies work, how societies function. Measles is a lens, and what we'll be exploring today comes from booster shots. Adam Ratner's book, The Urgent Lessons of Measles and the Uncertain Future of Children's Health.
So we're on a mission here. We want to break down all the important stuff from this book. I mean, the biology of measles is pretty incredible, even if it's a little scary. And its history with us humans, well, that's a long and complicated story. And then there are the lessons, the crucial stuff we need to know for our health now and in the future. Where do we even start with something like this?
Well, why don't we start with how this tiny virus manages to be so contagious?
Yeah.
It's seriously impressive from a biological standpoint.
Okay, so take us there. How does it work?
So the measles virus, it's got this strategy where it targets very specific cells in our immune system, these macrophages and dendritic cells. And it does this by attaching to a receptor on these cells called SLAM.
Slam.
Yeah, it stands for signaling lymphocyte activation molecule. Think of it like a communication hub on those immune cells, a protein that plays a role in, coordinating and activating the body's defenses. The measles virus has this H protein. It's basically like a key that fits perfectly into the SLAM lock.
So it's targeting our defenders, the very cells that are supposed to protect us.
Exactly. These macrophages and dendritic cells are constantly patrolling our airways, right? But they end up carrying the virus right into the lymph nodes. And lymph nodes, they're packed with even more of those immune cells that have the SLAM receptor. So the virus can really start to replicate, spread within the immune system before we even know it hit us.
Sneaky little bugger. And is it true that it only infects humans?
It is, and that's because of that specificity I mentioned.
Mm.
The H protein, that key, it only fits the human SLAM receptor. Like it can't infect your dog or cat, just humans.
Wow. It's amazing how this tiny virus has evolved this incredibly specific way to get into our cells. But okay, so it gets in, multiplies like crazy, and then boom, we get the rash. But how does it manage to spread so effectively to others? How does it get out?
Okay, so this is another cool trick. Later in the infection, the measles virus starts using a different receptor, this one's called Nectin-4, to get back into the airway. But this time, it infects those epithelial cells, the lining of our respiratory system, from the inside out, essentially. It's kind of like sneaking out the back door.
So all those newly made virus particles are just hanging out in our airways?
Yeah, and with every breath we take, every cough, every sneeze, we're expelling tons of these viral particles ready to infect the next person.
So that's why measles is so contagious.
Yeah.
What is that term? R naught.
Right, the RA, or the basic reproduction number. It basically tells you how many people, on average, one sick person will infect. And with measles, the R is really high, somewhere between 12 and 18. That means one person with measles could potentially infect 12 or more other people.
That's a lot. And it's got to be even harder to contain an outbreak because, people are contagious before they even know they're sick.
Exactly. You can be spreading the virus for days before you even see the rash. And because it spreads through the air so easily, it can just explode through a population. It's kind of crazy how this tiny little thing can have such a huge impact.
It's pretty humbling. Okay, so let's talk about the history of measles, how we came to understand it. It seems like our understanding of diseases has changed so much over time.
Absolutely. In the early days, people thought diseases were caused by bad air, like literally bad smells in the air, the miasma theory.
Miasma, like swamp gas.
Yeah, exactly. It wasn't until much later, around the mid-1800s, that the idea of specific, transmissible things causing disease really started to take hold.
So, but people knew about measles long before that, right?
Oh, yeah, for sure. Some of the earliest clear descriptions we have of measles come from this Persian physician, Rhazes.
Yeah.
He was brilliant, lived in the 9th and 10th centuries, and he wrote this incredible book, this treatise on smallpox and measles.
And what was so special about that?
Well, for the first time, he really clearly separated these two diseases, smallpox and measles. Before that, people just thought they were the same thing. And Rhazes, he really emphasized, really looking at your patient's clinical observation. It was a huge step forward.
So measles got its own identity. Who else built on that early work?
Well, in the late 1600s, there was this English physician, Thomas Sydenham, and he was a big believer in learning by, observing patients directly. And his descriptions of measles were really detailed, like everything from the early symptoms to the look of the rash.
So more careful observation. And then there's that story of Peter Panum in the Faroe Islands in 1846. That seems like a major moment in understanding how measles spreads.
Oh yeah, for sure. Panem, he basically did some amazing detective work. He went to these isolated islands during a measles outbreak and tracked it. By looking at church records and talking to people, he was able to figure out that the incubation period for measles is, like, consistently about 14 days.
Wow, that's impressive.
And he also showed how incredibly contagious measles is. Like, even brief contact with a sick person could spread it. He also found that quarantine, separating sick people from healthy ones, actually worked to slow it down. And maybe most important, he realized how vulnerable people are if they haven't been exposed to measles for a long time.
So if a whole generation grows up without getting it, they're basically sitting ducks, right?
Exactly. This idea that measles is this civilized disease, as William McNeill called it, became really important. As cities grew bigger and more crowded, there were always new babies being born who hadn't had measles, so it could just circulate constantly in these big cities.
But in more isolated places like the Faroe Islands, it would come and go.
Right. It wouldn't be around all the time, but when it did show up, it could be really devastating. And of course, there's that really tragic part of measles history, the impact it had during European colonization.
Yeah, those were dark times. Measles, smallpox, those diseases just wiped out huge numbers of indigenous people in the Americas and the Pacific.
It's heartbreaking. The indigenous people had never been exposed to these diseases, so they had no immunity. The death rates were just horrific, much higher than among the colonists who had at least some immunity from being exposed as children.
Some really dark chapters there. And the book talks about how some colonists saw these outbreaks as like some kind of divine intervention, clearing the way for them.
Yeah, it's a pretty disturbing way to look at it for sure.
Hmm.
And it wasn't just in the Americas. The Fiji outbreak in 1875 is another example. The king, he came back from a trip abroad with measles, and even though they tried to quarantine people, it still spread like wildfire.
Measles has been a part of some pretty significant historical moments, for better or worse. Okay, let's shift gears a bit. What about this issue of health equity? It seems like measles has always hit certain communities harder than others.
Yeah, that's a really important point. Socioeconomic disparities have consistently been linked to measles mortality. I mean, back in 1885, this doctor, Harry Drinkwater, he was looking at a really bad measles outbreak in England. And he realized that poverty and malnutrition were major reasons why so many people were dying. It wasn't just about sanitation.
So being poor made you more likely to get really sick, even die from measles.
Exactly. And then there's this other study by James Halliday in Glasgow. He was looking at these really crowded tenements, and he found that kids there were getting measles at a younger age, which made them more vulnerable to complications. It's like that saying, money buys space, air, and light, and those are the things that were missing in those tenements.
It's a good reminder that our health isn't just about our genes. It's about where we live, how much money we have, all these other factors.
Absolutely. Measles really shows how our health is connected to things like socioeconomic status, where we live, access to resources, and even historical injustices like colonialism and systemic racism. All of these things play a role. If you're interested in exploring these kinds of connections further, you might find Mindful Moments in our podcasts interesting. It's an AI audiobook analysis channel on YouTube that delves into various themes like these in a pretty insightful way.
Makes you think. Okay, so let's talk about prevention. It's kind of easy to forget how amazing vaccines are, We just take it for granted that we can protect ourselves from these diseases.
It really is remarkable. I mean, the whole idea of prevention, of making nothing happen,
Mm-hmm.
it's hard to wrap your head around sometimes.
Yeah, because you don't see the people who don't get sick, right?
Exactly. And the early attempts at prevention, well, they were pretty different from modern vaccination. Like in the early 1700s, they were doing something called variolation for smallpox.
Variolation, what's that?
They would actually take material from a smallpox sore and expose someone to it on purpose, hoping to give them a milder case and make them immune. It was a risky business. This woman, Lady Mary Wortley Montagu, she saw it being done in Turkey and brought the idea back to England.
That's brave. But were there any similar attempts for measles?
Yeah, there were. Back in 1758, this doctor, Francis Home, tried using blood from infected people to inoculate against measles. We don't know how well it worked because he didn't really follow up with his patients, but it was the first real attempt. And then much later, in the early 1900s, Charles Herman in New York City, he was doing this thing called snot inoculation.
Snot inoculation, that sounds pleasant.
Yeah, he was basically trying to give babies immunity by exposing them to nasal secretions from kids who are in the early stages of measles. That's kind of crazy by today's standards, right?
Yeah, no kidding. But it's fascinating to see how far we've come. So how does we finally get to a real measles vaccine?
Well, it took some major breakthroughs in our understanding of viruses and the immune system. John Enders, he figured out how to grow poliovirus in the lab, which opened up the possibility of growing other viruses, including measles. And then David Edmondson provided some crucial measles samples during an outbreak at a boarding school. And a researcher in Ender's lab, Albert Peebles, finally managed to isolate and grow the measles virus.
And that led to the vaccine?
Yep. By the late 50s, early 60s, they had developed the Edmondson strain measles vaccine. And it worked, but it had some side effects, like fever and rash. But then these guys, Maurice Hilleman and Joseph Stokes Jr., the measles vaccine was approved in the U.S. in the early 1960s, which was a huge deal. It was mostly distributed through private doctors, though. There wasn't like a big public campaign or anything. And they actually had both a live and a killed version of the vaccine, but they preferred the live one because it gave longer-lasting immunity.
Interesting. So that was kind of like the first wave of measles vaccination. What happened next?
Things really picked up when President Kennedy proposed this national vaccine program in 1962. It started with polio, but then they added measles. This meant the federal government was putting real money into getting people vaccinated.
So it was starting to become a national priority.
Exactly. And by 1967, they had this goal of eradicating measles in the U.S. They started putting more money into public awareness campaigns, and there was this real hope that they could get rid of measles for good.
But it didn't quite work out that way, did it?
No, it turned out to be a lot harder than they thought. They made some progress, but measles is stubborn.
And then I think, wasn't there a resurgence of measles in the late 80s and early 90s?
There was. A few things contributed to that. Some kids, especially in poor urban areas, weren't getting vaccinated. And then there were some older kids and young adults who had only gotten one dose of the vaccine, which wasn't always enough to protect them long term. So there were outbreaks, and a lot of Black and Hispanic children were hit particularly hard.
It's so frustrating when we have these tools to prevent disease, and then we don't use them effectively.
It is. But then there was this program called Vaccines for Children that really made a difference. It helped low-income families get access to vaccines, and that led to a big jump in vaccination rates.
And that's when they declared measles eliminated in the U.S., right?
Yeah, in 2000. It was a huge victory, but it was also really fragile. They knew that if vaccination rates dropped, measles could come roaring back.
Which brings us to the anti-vaccine movement. And of course, there's that infamous study that linked the MMR vaccine to autism, even though it's completely debunked.
Yeah, that 1998 study by Andrew Wakefield, it was a disaster. The journal retracted it because the research was fraudulent, but the damage was done. His claims about the MMR vaccine and autism just took off. And even though there's tons of evidence proving he was wrong, his narrative still has this hold on some people.
And it's led to real outbreaks, right?
It has. There were outbreaks in Indiana in 2005, and then in the Somali American community in Minnesota. And both of those outbreaks were linked to misinformation about vaccines and autism. And then there was that big outbreak at Disneyland in California in 2014 and 2015, which was partly due to people not getting vaccinated.
I remember that. It was all over the news. So what are we doing to fight back against this anti-vaccine stuff?
Well, some states have passed stricter laws. Like in California, you can't get a non-medical exemption to skip vaccines for school anymore. But, it's a really tough issue.
Yeah, people have strong feelings about it. Okay, so looking back at all this history, what are the big lessons? Where do we go from here?
Well, I think measles really shows us how powerful vaccines are. They're not perfect, but they've saved millions of lives. And we also have to remember that measles can actually weaken your immune system even after you recover. It's called immune amnesia.
Immune amnesia. That sounds scary.
It can be.
Yeah.
And it means we really need to make sure people trust science and public health. We have to be transparent, answer people's questions honestly, and build that trust back up.
I agree. We can't just dismiss people's concerns, even if we think they're based on bad information.
Right. The goal is to eradicate measles globally. We have the tools, the vaccine works, and we could get rid of this disease for good. That would be a huge win for everyone.
I hope we can make it happen. This has been a fascinating conversation, a bit overwhelming at times, but really important. If you're interested in learning more about this stuff, you should definitely check out Adam Ratner's book, Booster Shots. You can find a link to buy it in the show notes. And please subscribe to the show if you want to hear more deep dives on these kinds of topics.
And don't forget to share it with your friends.
Yes. Spread the word, not the measles. And most importantly, think critically about what you read and hear about health and science. There's a lot of information out there, and not all of it is good.
That's right. Be skeptical, ask questions, and don't be afraid to challenge your own assumptions.
Thanks for listening, everyone. Stay curious.